This is a WRAL News special presentation. Coronavirus, facts, not fear.
First, let's begin with the latest coronavirus headlines. The CDC now says there are more than 420 confirmed cases nationwide. 34 states and D.C. have patients. And we have just learned within the past quarter hour, 5 more patients in Wake County have confirmed cases of coronavirus. A man from Indiana who tested positive visited Wake and Durham counties last week while showing symptoms, and it appears that led to those new cases we just learned about.
Joining us are State Health Director Dr. Elizabeth Tilson, Regina Petteway, the Wake County Public Health Director, and Dr. Tim Sheahan, an assistant professor at the Department of Epidemiology at UNC-Chapel Hill. Thank you all so much for joining us. First, though, we want to get straight to Mark Boyle in the Live Center with what we're just learning about these additional Wake County cases. Mark?
Deborah, those 5 additional cases were just confirmed within the past 15 minutes from Wake County. I want to bring everyone up to speed. This is the headline right here. Wake County begins investigation of 5 people with COVID-19 in the area in blue. These new cases bring the total count of presumptive positive cases to 6 in Wake County. The 5 brand new ones are all connected to the Biogen conference that was in Boston. At the bottom of this release right here, that's what they're talking about right here. All 5 people attended this Biogen corporate conference in Boston in February. More than 24 people have confirmed COVID-19 cases from that conference. Now, in addition to that, we also mentioned the one man who works for Biogen that flew through RDU just a few days ago, also connected to that tech company at RTP. This is a story that I'm going to work on this evening for 10 and 11 o'clock, but that new information just released, 5 new cases, bringing the total cases in Wake County to 6. Back to you.
This is truly changing by the minute. Thank you, Mark. And before we start with questions from you, let's talk about the latest on where North Carolina stands.
This new information on the man from Indiana who traveled here last week, working at Biogen and RTP last week. So, Dr. Tilson, what does your agency do when information like this is passed on? And beyond what we have just learned in the past 15 minutes, what do we know that you can talk about?
Yeah, and just to clarify that these new 5 cases were also at the same Biogen conference as the first Indiana man. So we don't think that these 5 cases are linked to the first case, that they all probably got exposed the same time at the Biogen conference in Boston. So just to clarify that risk. When we find out, this has actually been a great validation of the strength of our public health infrastructure. And we have found out about different cases as different state health departments have been contacting us. Then we work in partnership with our local health departments. For example, the first man from Indiana, we were contacted by the Indiana State Health Department to let us know that he was diagnosed in Indiana, allowed us then to have that information to be able to do the contact tracing in Wake County. Same thing with these cases. So what we do is when we learn about it at a state level, then we identify where is that person, and then we immediately contact our local health departments, and our local health departments put into place all of the things that they're really good at, which is then understanding where that person was and doing all that contact tracing and monitoring.
You know, so many people want to know so much information so quickly. And we understand that you have to verify, you have to live into HIPAA rules, you have to live in the privacy of people, and yet there is fear amongst a lot of the public. When you're sitting around those conference tables, taking in all this information, walk us through how those decisions are made of what you can talk about and when you can talk about it, if you would.
Yeah, which is really, really important conversation. Let's talk about what we reveal and when, and then let's also talk about risk, if we can, because I think that plays into this. So we always want to be as transparent as possible, especially in a situation where people are scared, things are moving rapidly. We understand people get really scared if they don't have information. People are much better if they have the information, so we want to be able to push out as much information as possible. However, we also want to be sure that we're protecting a person's privacy, and especially when there's fairly few cases and such heightened media attention, it gets pretty easily to identify that person. So we want to be sure we're protecting that person's privacy. We also want to be sure, one reason to protect the person's privacy is that And we have found in another case that the person was easily identified and then started getting harassed and threats, and we're really worried about that because we want people to come forward if they think that they've been exposed or have symptoms. We want them to come forward because that's how we can do the control measures. So we have to balance that privacy. But the other side is we also want to release what information we need to protect the public. And so that's when we get into this issue of risk. So with this infection, we think that it is spread what we call by respiratory droplets, which means you have to be in pretty close contact within 6 feet for a prolonged period of time, more than 10, 15 minutes. And so it's not like something like measles. Measles is different. Measles is airborne, it's easily spread. With measles, then we say, ooh, if you were in this location at this time, you need to know. This is not measles, this is respiratory droplets. So what we're doing is identifying who is at risk, who's at high risk, which would be household contacts, who's at medium risk, within 6 feet for 10 to 15 minutes, and identifying those. People who were, let's say, just in a restaurant, more than 6 feet, or just walking by in a grocery store, they're not at risk. So those are the things that we balance as we think about what amount of information to put out.
Regina, let's talk about testing, because I know that's a question a lot of people have right now. Now that you have these cases in Wake County, do you feel that you have the test kits available that you need to be able to test these cases?
Well, actually, at the county level, we do not test. Our job is to do the investigation and the tracing. Our state lab has testing capabilities now, and the Centers for Disease Control, I think, as well as some private labs.
So you did this investigation and you said we need to have these people tested. Is that how that worked?
Yes, so we do the investigation. We, where warranted, have a sample that we send to the state lab. And the state lab tests. If it comes back positive with the state lab, it is still labeled as presumptive until CDC also tested. I believe that's still the case.
You know, we've had several people emailing us and on Facebook today questioning, saying, if I were to develop this virus, if it presents in me, and I self-quarantine or I'm quarantined for 14 days, and then the virus passes, can I be subject to having it again in this same year? Do we yet know that?
It's unlikely that you would get reinfected. So some things that I've been reading today say that your body makes antibodies to the virus, which protects you, which come up maybe after a few weeks, and are present there at least until a month after you've recovered. So it's unlikely that you could get reinfected unless, of course, you had some underlying immune deficiency which made it such that your body didn't react appropriately to protect yourself from future infection.
Yeah, and I want to go back to something for a moment. Coronavirus itself has been around.
Dr. Sheahan's been testing this for many years.
Yeah, this is not, I mean, but it's the COVID-19 that has our attention now. So a doctor told me last week, if you were infected with this years past, there could be an antibody within you, and if you were tested again today, but weren't having current symptoms of this strain, it could still show up within you.
So I'm happy to tackle that, and then you can as well. So the coronavirus is a family of viruses, right? So there's 7 different coronaviruses that can infect humans. 4 commonly circulate. We see them in cold and flu season, and they tend to cause pretty mild symptoms. And those are the ones that there's kind of routine tests for. So there's 4 commonly circulating coronaviruses. Then there have been 3 that are novel and that were more rare. So we had SARS a while ago, we had MERS a while ago, and now COVID-19, which is, again, a novel one. So this was a new form of the virus and this new one's this newly identified in December. And so it is new, genetically unique to the other circulating coronaviruses. And so the reason that it spreads pretty easily is that nobody has the antibody to it because nobody's been infected with this particular strain before. So you haven't built up that immunity. So that's why it gets spread pretty easily, because nobody has that immunity to this particular strain.
One of the
right?
questions that we're getting to is that a lot of these cases obviously are showing up in Wake County in the urban areas. What about, Chelsea would like to know, what about people who don't live near the big city? How readily available, she asks, are the tests for coronavirus in the rural parts of North Carolina? Dr. Tilson.
Yeah, I'll take that. So as Regina said, right now, testing is limited to what we call high complexity labs. So the state lab has the ability to test. Now, in North Carolina, we have incredibly robust local health departments in all, covering all 100 of our counties. So even in our rural areas, if somebody thinks that they've been exposed, they can go to their doctor, they can go to their local health department, they can get the swabs and get tested in that local area, and then we get it shipped to the state lab. So people in the rural areas have much access to testing as those in the urban areas. And now that some of our commercial labs are coming on board, LabCorp is starting to test as well. And so those providers can send it to LabCorp as well. So it shouldn't be an issue of access to testing where you live in the state.
On that point, we're going to take a break. When we come back, I want to have a couple of more questions about testing and why it appears to have been so hard to get the kits, and just to let people know where we stand on that. We'll be right back. Welcome back as we discuss the coronavirus and how we should process the headlines as the virus spreads all around the world.
We have questions for you that we're going to be getting to, but we want to go back to talk about the testing issue.
Yeah, I was listening to the governor last week, and he talked about that we had 150 kits and there were another 500 that were coming, but LabCorp was going to begin in this and UNC was going to begin in the testing. And it was a little confusing to say, were there only 650 kits allowed for the state? Where does LabCorp get its kits? Where does UNC get their kits? Are they the same? Is it hard to mass produce a number of kits? Why the shortage? Can you give me a more concise answer than the question was, possibly?
Yeah, so I will try my best to give a concise answer, but it's a really complicated issue. And so there is, we have kits from the CDC. However, the kits are not complete. What we need is a particular part of the process that allows us to actually extract the genetic material from the virus. We don't have a good supply of that extraction testing piece.
So the CDC sends incomplete kits to the state?
We don't have, correct, we do not have all of the pieces of those. So we have kits, we only have the extraction assay or the piece to extract the RNA right now for 150 people. And I clarify people as opposed to kits because what we want to be sure is what people are interested in is how many people can get tested.
Yes.
And typically the gold standard is 3 samples per person. Okay is 2 samples per person. We would, right now we're worried about only doing 1 sample per person, so it'd be 2 samples per person. And we have sufficient full replete of supplies to test 150 people. We expect that we'll be getting more supplies from the CDC, especially of that extraction assay, to do an additional 80 people. And the CDC did open up how much of that, especially that assay, we could order. But at the same time they ordered it for us, they also opened it up for all the commercial labs. So now everybody is ordering and we're in a queue. So we still are having a hard time getting all the pieces that we need for the full testing capability. So, but the good news is LabCorp has come online and that will be helpful. And then when our universities come online, that will be helpful as well. But we may all be competing for the same parts of the full replete testing. So that's the thing we've been really challenging with. We want to test more. We absolutely want to test more, but we're challenged with having all of the testing supplies that we need.
How many negatives have you gotten?
So the numbers are changing in real time. As of last night, we had, I'm hesitating only because I want to be sure I have the numbers right.
Percentage-wise, though, are you seeing a lot more negatives than you are
positives? Yeah,
positives?
we're seeing more negatives than positives. Yeah,
Okay.
yeah. We're seeing more negatives than positives. I think we have about 25 negatives or so, but that number is changing.
Regina, there could be a conundrum there that If someone is referred, someone in Wake County, doctor says you need to be tested, and yet the supplies are not all here yet, a person could be developing symptoms even more so, not knowing if they have a bad allergy or something else going on, the flu or this particular strain of coronavirus. So you've got a lot to keep in balance there in referring people to the state as well, do you not?
Absolutely, and I will say that during that time, we advise people to stay at home and stay away from other people. And so we work with our state partners to get information out to all of the folks that are also involved around that person. We have to trace not just the person that had the sample drawn and the test was sent to the state, but then you also have to trace contacts. And it's our communicable disease nurses that work case by case with both the person that had the sample drawn and the contacts.
And Dr. Sheahan, you've been doing a lot of work on coronavirus over the years. Tell us about your work at UNC and what you're doing trying to fight this virus.
Yeah, so we've been doing coronavirus research for decades now, and originally on the first SARS coronavirus, then on MERS coronavirus, and now on the new novel coronavirus that causes COVID-19. And because lots of different coronaviruses circulate among different wild and domestic animals, we've always thought that there's high potential for a new coronavirus to spill over into humans from some wild animal reservoir. And this is what's happening right now, right? And so to prepare for that, we've been trying to develop broad spectrum antiviral therapies that work against the coronaviruses that we know about, but also ones that might emerge in the future. And one promising drug that we've been working on for the past 5 or 6 years is called remdesivir.
We've heard that in the headlines,
right.
Certainly. People talking about it.
This is now in clinical trial in China and in the United States. I don't know how many people have been enrolled in these trials here in the States, but the ones in China should read out in April. So we should know if this is going to help or not pretty soon.
Before we take another break, I'm curious, do you view or do we yet know if this is a seasonal ailment? We see more flu in the wintertime traditionally, at least in the Northern Hemisphere. Are we expecting that with this virus?
It's hard to know how this is going to evolve. So it's really hard to answer that. You know, there's a hope that maybe the numbers of new cases will decrease as the temperature goes up in springs, but it's really hard to say if that's going to happen right now.
The virus spreads from person to person, but we spoke with someone today who had a question about another possible way coronavirus could spread. Here's her question.
Is it going to be spread through our money? I'm not just worried about coming in contact with a person, but with somebody that's coughed, sneezed, anything like that onto our money. Is it going to be spread that way?
Dr. Tilson?
So I think the honest answer is probably not much. I think that there could be a little bit of a risk of spread if someone is coughing and sneezing on a surface. But what we know about the other coronavirus is that it only lasts a couple hours on a hard surface and then dies. So I think the risk of spreading on money, and we had a lot of questions about how about packages coming from China?
Right.
I think the risk of that is very, very low.
On that note, we are going to take another break. We'll continue our discussion in just a moment. Welcome back to our discussion regarding coronavirus and looking at facts versus fear. Now we're going to talk about the differences and similarities regarding flu, although they're two totally different things. Worldwide, there are about 108,000 cases of coronavirus compared to about 1 billion cases of flu each year. Coronavirus has caused 3,700 deaths that we know of. Flu kills about 300,000 people every year. And for now, there's no vaccine for coronavirus. However, there is for seasonal flu. So, Dr. Regina Petteway, we look at these and people want to compare these two. Are we comparing apples to apples here? Or is one and one something totally different?
Well, What I like to talk about is the fact that they both will infect you, and there are preventive steps that you can take for both of them that are similar. I think part of your question was, what are the similarities? So the similarities have to do with how you can prevent being infected as much as you can, and that includes proper hand washing, and hopefully we'll get to talk about what that means, not just sprinkling your hands under the water.
You talk about it right now.
Okay. And so proper hand washing means that if you can, you have warm water and soap. You turn on your warm water, you rinse your hands, you soap them up real good, and then you rub the backs of your hands, the fronts of your hands, in between your fingers. While you're at it, kind of clean under those fingernails. You know, that's not something you can do in 5 seconds.
You sing happy birthday twice,
At
right?
least twice.
Okay.
Yes. And once you do that, you rinse your hands off very well again. Turn the water off. Some people use a paper towel, but I'll let the doctor speak to that. We don't know if that helps or not. But the point is, wash your hands. When in doubt, wash your hands.
How many times a day do you need to do that?
I don't know that there's a number, but what I would do is, if I'm in a crowd around people, I'd go wash my hands. If I'm touching things that I am not used to touching, even if I'm touching things I am used to touching where there are other people, I'd wash my hands.
Right now I walk in a Costco or the grocery store and everybody is wiping down the grocery carts, for example.
Absolutely.
Yeah.
And
Go ahead, I'm sorry.
And so you can wipe down the surfaces, but again, the best thing to do is to wash your hands. Keep your hands away from your mouth, your eyes, and your face. And if there are people who are coughing or sneezing around you, what I do is kind of move away from them.
If you can. I was on a
If you
flight
can.
this past weekend, did not experience that, but people were wiping down the areas around the seats, and the flight attendants came on and said, please, we notice you're doing that, don't put those in the seat back. People were actually wiping the space and then putting the dirty wipe into the back of the seat. And it's like you just weren't thinking it through. But speaking of that, and we'll talk about this more later, but there was a flight last night that had to be diverted to Colorado Springs because someone had an allergy and was coughing and sneezing, no fever, and fellow passengers became abusive to this person for fear they were going to contaminate them, as if to say, what you have is going to kill me. And I think that type of panic or near panic is just this level of irresponsibility. How do we get beyond that?
That's a great
Tim, that's what I was going to ask you about, the deadly nature of this. How worried do we need to be?
Yeah, I think depending on who you are and how old you are, and if you have any other underlying health issues, for me, that would dictate how worried I would be. So if I was 85 years old and I lived in an urban area and was out and about in public often, and I had some other underlying either respiratory or other health condition like diabetes, then I would probably be more worried than if I was a 25-year-old living in a remote area of the United States.
On that note, we need to take another break. When we come back, we'll get to more of your specific questions. We'll be right back.
A cruise ship with 21 people infected with coronavirus docked today in California. The passengers on the Grand Princess were taken to a military installation where they will be quarantined for 14 days. From cruises to airlines, people have a lot of questions about whether or not it's safe to travel.
And with spring break right upon us, many people are second guessing their travel plans. Would you be comfortable flying right now, taking a cruise? And would you answer that question if you were 65 or older, as you referenced a moment ago? So I want to ask all three of you. Would you fly tonight? Would you take a cruise tonight?
So I don't think it's so much the flying, it's the where you're going that I would think, right? And so thinking, what we're encouraging people is check the State Department, check the CDC website, because there are high alert or high impact areas and there's travel restrictions. So I would be following the CDC guidelines and not traveling to an area with high impact.
But you would feel comfortable flying in a contained metal tube with another 120 people?
Yes, I would.
Regina?
Yes, I would fly. I would not cruise right now. It's interesting, this morning I talked with about 400 students at St. Augustine's University. They're about to go on spring break. And the main message to them, besides wash your hands a lot, is to really find out where you're going and what the incidence of COVID-19 is, where you're going to. And that will help you know what to do. But we really need to get to our students before they go on spring break and to help them understand, again, what they can do to help prevent the spread of this.
Doctor?
I was supposed to go to an antiviral meeting, a conference at the end of the month in Seattle. And I hesitated booking my hotel and planning on going to the meeting because of the evolving situation in Washington State. And the meeting ended up being canceled, and now it's a virtual meeting, so I don't have to contemplate whether or not I feel safe flying. But that is a state that's under a state of emergency, so it's probably not a good place to visit.
Do any of you
anyway.
have any trips planned now? And if so, are you going to keep them in place or cancel?
Well, I was supposed to go to Florida tomorrow, but the meeting was canceled, and so I didn't go, but I would be
Well, at
going.
least with technology, a lot of the work can still continue.
But speaking of travel, I was in the Nashville airport Saturday night, went into a restaurant to watch the Duke-Carolina game, and I saw so many doctors from Duke that I know at that game sitting side by side. The ACC tournament starts tomorrow. 20,000 people are going to be gathering on many of those days, or are expected to. Vendors will be there for hours upon hours. I don't know if you're a basketball fan or not, but would you go to the ACC tournament?
Who would be buying me the tickets?
If I bought you tickets, if you had tickets, as far as safety is concerned, would you go?
Where's the game being held?
It's in Greensboro, 20,000 people.
I'd probably go.
Regina?
I would not go. Because I don't know where all of those people, where they're coming from, number one, and what I'd hate to do is pick something up to bring it back to Wake County and Raleigh. So I'd probably be a little more conservative.
Dr. Tilson?
Unless it was a Carolina ticket.
Yeah. Sorry. Well, we won't get to what our team allegiances are.
But would you go to the tournament?
So I would go. However, what I would counsel is that if you are 65 and older, or you have an underlying chronic disease that would put you at higher risk, then I would have you consider. But a younger person without underlying, I would go. But I think it is starting to get prudent that the recommendations might be different for different people in our population. So a person over 65 or with underlying medical conditions, they might want to think about that.
To that point, we have another question about the spread of coronavirus on surfaces. Here's Terrell Mayo. Listen to his question.
My question would be, since I just came out of public restroom, would coronavirus be able to be transmitted by hand touching the doors?
So Tim, what do you think? What about if you go into a public space like that?
There's definitely the potential. So you have to be really careful, definitely in a public bathroom. And I recently read this study in Singapore where they tried to detect and measure the virus in a hospital room where a patient had COVID-19. They sampled the room before they cleaned it and after they cleaned it, and they found evidence of it on surfaces before the cleaning crew came in and cleaned the room, but they had a really hard time finding it after. So public bathrooms, I don't know, they're probably cleaned with different frequencies depending on where you are. But I would just be really careful, wash my hands, touch the doorknob with a paper towel rather than bare hands, and just be really careful about the things that I'm touching as I'm in there and go to leave.
We've talked a lot about hand washing. We've seen shortages on hand sanitizer. We were told hand sanitizer can be good, but it's not going to kill the virus. Do you recommend? You're shaking your head.
I think, yeah, as long as it has enough alcohol in it, hand sanitizer should do it.
It's okay to use in good. That's why we're seeing the shortage.
60%.
Yeah.
And I also saw in New York State today, where Governor Cuomo was talking about, they've had the prisons develop hand sanitizer.
They're making their own.
That they can sell for $6 a gallon to stop price gouging. Now, I know the Attorney General is working on price gouging to a degree in this state, but we're not yet under a state of emergency in North Carolina, correct?
That is correct.
So that price gouging law is not in effect. We're just asking businesses to do the right thing. But it's something we have to be aware of.
It is, yeah.
Dr. Tilson, what are the conversations on the state level as far as, what threshold will it be before the governor may declare a state of emergency? Obviously now we have nearly 10 cases in the state, so what's the threshold for how much we start locking people down here in North Carolina from not traveling?
Yeah, and so we've been thinking a lot about this since mid-January. We have been preparing and thinking through all of our decision matrices. What would be the trigger for this? What would be the trigger for that? And we're really trying to think about what's our measured approach for different interventions. There's a whole host of different interventions that we can put into place. Because there is no vaccine or medicine for this particular virus, then what we'll be putting into place is a series of what we call non-pharmaceutical interventions, NPIs, or community mitigation, right? And so it's a whole series of things about social distancing, about what about mass events, about what about workplace accommodations. And so we have a whole grid of different decision matrices depending on the spread of the disease, depending on the severity of the disease, and then an escalating matrix of increasing community mitigation strategies we can put into place. And we just had a long meeting with the governor just today and thinking about exactly when are we going to start doing those different things. So it's an active conversation.
Yeah, I'm really curious about all the numbers that are floating around. I know we have the 5 new cases now in Wake County tonight. Numbers that I've seen, there's a large percentage of people who were diagnosed as having the symptoms and having coronavirus, COVID-19, who no longer have it, that it's moved through their system. They seem to be left out of the conversation. The first 2 cases in Wake County, more than likely, fairly soon, that illness will be gone from them, but they will still be listed as numbers of cases we have had. Is it time to focus as well on the fact that 97% of the people who develop this live, and that ultimately it will pass through your system as the flu does, and you're over it? Or are you tainted with those? I mean, it seems like we're leaving out that we're stuck right here in the center of here are the active cases, and we miss the point that in 10 days or 14 days, these active cases no longer will be active. Am I tone deaf to this, or?
No, I think you're right, and I think part of our job is to help people be a little more calm and to focus on what they can do. I mean, you see these big globes in red behind us. It's scary to people when something is new and they've never heard about it before. They're afraid of getting it themselves or passing it on to somebody.
And knowing there's no medication to treat it
and possibly killing somebody else, if not themselves. So we have to help people understand that there are things they can do to minimize their exposure to this. And then at a certain point, as Dr. Tilson said, there are things that the state or your local government will do to help contain this also.
Let's take another break. We'll be right back.
Welcome back to our coronavirus special, Facts, Not Fear. And we want to reintroduce our panel. We've been having a great discussion this hour. Joining us, Dr. Elizabeth Tilson. She is the State Health Director. Regina Petteway. She is the Wake County Health and Human Services Director. And Dr. Timothy Sheahan, an assistant professor in the Department of Epidemiology at UNC-Chapel Hill. Our next question is about the impact on schools. Let's listen.
So I'm wondering how likely it is for the coronavirus to spread to students on campus.
So we've already seen several schools that have had to cancel or scale back in-person classes. Today out of Georgia, we had a report saying that a whole district was going to cancel classes because a teacher tested positive. So what do we have to say about the schools? Dr. Tilson.
Yeah, so we've been thinking a lot about that as one of our strategies. The one thing we're finding is that kids in general have very mild, if any, symptoms. And so you have to think about, if you're going to close schools, then where are those kids going to go? And so you have to think about, if you close schools, you have to be sure that there's another, that they're not congregating another area. And then you have to think about, then parents have to miss work, or if parents are going to work, then kids then stay with grandparents who we know are at risk. So it's a really difficult decision about the benefits of school closing or not. And we are looking at all of those numbers and all of those decision matrices. Right now, we don't have plans to close school, but we will be continuing to monitoring and see if we need to make that decision.
What about, Regina, what about any extra cleansing going on in the schools right now?
Well, with the Wake County Public School System, I haven't heard that they're doing any extra cleansing, but they are really paying attention to the general cleaning and the regular cleaning that they do.
I walk around here and I smell the spray.
Yes.
I mean, people
Yes.
are definitely doing it in the workplace, but you wonder about the schools as well.
Right, and I'd be hesitant to speak for the school system. I'm sure that they're paying attention to all of their cleaning techniques. And I'm sure that if they're not, they will be also asking students to help them, again, by washing their hands, maybe helping them when they're at a seat to wipe it down when they leave. So there's a lot that schools can do.
You know, I'm curious, Dr. Scott Gottlieb with the FDA has said we are past the point of containment. It's going to continue to come. There are going to be more cases. As we said earlier before we began tonight, I think, Dr. Tilson, you said we will get through this. Tomorrow morning, however, when your day begins in the state of North Carolina, there are going to be at least 5 new cases in Wake County than we had today. Would you walk us through what it will be like in your office tomorrow morning, the discussions that will be held, how things have changed, and what you'll be looking for to tackle tomorrow?
Well, I think that what we'll be doing is, as I mentioned, we're doing a lot of planning about different strategies, different of those community mitigation strategies. So we're going to be looking at all of our menu of things that we want to recommend. What do we want to put into place? Do we want to escalate some more of those strategies? So that's what we're actively doing today and we'll be doing tomorrow. Are there other strategies that we wanted to put into place? We still want to be doing that very tight contact tracing, but we also want to start thinking about what are the community level things that we might want to put into place. So that's what we'll be discussing, is what do we want to put into place.
Do you have any extra people to help you do all of this when it comes to these investigations? And I can imagine that contact tracing could take a whole day just to go through someone's steps. I mean, that's a long process. No extra people.
No extra people.
It's just you.
At this point.
Okay.
You know, I was just reminded of something by our producer speaking to me in the earpiece, that as I've been sitting here, I've been touching my face a lot. It's something that we do.
You don't think about it.
Someone said to me the other day, what about licking your lips? Again, it's an involuntary motion and movement that we do, that we need to make each other aware of what we are doing that we don't even realize. So Kelly, thank you for that. But it's just something I've done all these decades of life and didn't stop to think about it today. That's not surprising to you, is it, Tim?
No, there's an itch right here, and I'm avoiding it. Because, but for that very same thing, I'm definitely more aware of that now than I used to be. even sitting here. I haven't noticed you per se, but it's definitely something that I'm more aware of my hands and my face and touching my eyes and things like that.
You know, how do we keep from living in a bubble? I mean, life goes on. We can wash our hands, we not touch our face, try not to lick our lips, try not to touch anything. When you look at your colleagues or you talk to your children or your grandchildren, what do you tell them about how to live their lives? Be vigilant?
Well, I would just say the hand washing, the not touching your face, if it's not automatic now, do it enough so it's automatic so you don't have to worry about it and you don't have to think about it. Just think about it as forming a good habit.
Not shaking hands too. I mean, this is something that we just discussed as we were meeting you all as well. I even saw a neighbor in the voting booth when I was voting last week who didn't want to shake hands. So the arm bumping, the fist bumping becoming a lot more popular, or wave as we kind of did too tonight, as you said, you know, just kind of changing your habits to the point where maybe that becomes just a natural process, even though it seems so unnatural not to shake someone's hand.
And I think that when, as we do expect, we'll see more and more spread. And again, for the vast majority of people, it'll be a mild illness and they'll get through. So I think we have to balance, right, the fear with living our lives. I think the very common basic sense approaches that Regina is talking about, that's going to go a long, long way. And the other thing I would say, as North Carolinians, there's been so much fear in the beginning. As we start spreading, we're going to have to move away from that mindset of keep them away from me, and instead, how do we all protect each other? How as a community we come together, we protect each other, so that, and protecting each other means if you are sick, don't go out. And then also really think about who amongst us are really at the highest risk. So thinking about our older people, underlying conditions, how as a community can we wrap around those high risk people and make sure that they have what they need? And so thinking about, you know, if you have neighbors who maybe are older or sick, check in on them, make sure they need something. If they're trying not to go out that much, can you get them the supplies that they need? So this is going to be a time as we start seeing more and more cases, we can either react to it with more fear and panic, or we could say, we're in this together. How do we protect each other, and especially the most vulnerable around us? So I hope we can start making that change as a community and as a state.
But you know, and I think that's a great goal, but psychologically, when you see what's happened with the economy just in a couple of weeks, with 2,000-point drop in the stock market today, price of oil going through the floor, all these different things, people realize, wait a minute, we weren't quarantining people. We don't quarantine for the flu. We don't see the economy being squeezed because of the flu. This fear of the unknown is in the middle of the room, and it's
and yet
impacting
more people
everyone.
die of the flu here in North Carolina. We've had 11 people just last week, so.
But at the same time, because there's no cure yet, because there's no way to stop this yet, it's quite unnerving. To people who are nervous about this, wringing their hands, Doctor, what do you say to them?
That's a great question. And, you know, depending on who they are, you know, that's as you can see, I'm having a hard time.
That's okay. I had a young mother say to me the other day, what do I do? What do I do?
I think you just take the common sense approach that we've been talking about, more them than I. That, you know, you just have to be aware of the people around you and your own health status, and just try do the best that you can. But
and also, if you're worried and you have a health care provider, don't go to their office, but give them a call. They usually have a nurse line or somebody that you can talk to. And the reason I'm holding this in my hand is because Wake County also has a number you can call, 919-856-7044, or you can go to our website and actually ask a question. So if you're nervous about it, ask somebody.
Yeah.
Are you getting questions that make you shake your head? Saying, no, wait a minute, surely you don't think this could actually happen?
Oh, there's never a bad question.
I like that answer.
You're quite the diplomat to send you to the UN. We need to take a break. We'll be right back.
Welcome back. We've spent almost an hour now answering your questions and all of our questions about how to protect ourselves. Tim, I want to go back to you about the research being done about a vaccine. Where does that stand?
So I've heard recently that one of the most promising vaccine candidates is being tested for safety in people right now. And after that, it would need to be tested basically to see if people generate an immune response, to see if the vaccine works. And then after that, it would be tested to see if it would actually prevent the acquisition of COVID-19.
Timeline for that? Like how fast will we know if it works?
I've heard maybe a year.
That long?
Yeah. It's a process that you don't really want to rush because it has the potential to cause more harm than good if you don't adequately vet the product.
In the meantime, what if COVID-19 hits the Raleigh Police Department or EMS? Or the fire department? What has the state or the county done in conversations about that? What would happen?
So we've actually been vetting those kinds of questions with our state partners, and they might have to be quarantined just like anybody else that has it. You might see a delay in services, but I would suspect an EMS could call on another EMS, and we could find ways to deal with that. But you may see some service disruption as this grows.
And I will say, as a state, as I said, we've been planning since January. We've been really connecting in, especially with our first responders, with our EMS, with our healthcare providers, with law enforcement, making sure they have all of the protection guidelines, making sure they have all the, yes, for those first responders, absolutely, making sure they have all that personal protective equipment. So we've been working very, very, very closely with our first responders, with law enforcement. There's guidelines for that. We've been pushing that out. We're making sure we're in really tight communication because that, and including our healthcare workforce, we have to think about our workforce, and so we've been working very tightly on all of the things they can do to prevent infection in those.
Regina, we don't have much time, but you wanted to talk about masks.
Yeah,
we have less than a minute.
All I want to say is if you're not sick, a mask won't do you a whole lot of good. They're really meant to contain what comes out of a sick person.
Yeah, someone said to me today, the worst thing you can say to me is, tell me to be calm. But yet we are telling people, be calm.
Well, actually, I'm telling people there's action you can take. And it's okay to be a little nervous about it, but use that nervous energy and channel that into some action steps. Again, wash your hands, don't touch your face, help out your neighbor.
Our thanks to all three of you for being here tonight. This program will be posted on WRAL.com. We've received a lot more questions than we've had a chance to answer tonight, but we'll continue to answer them in the coming weeks.
Again, thank you all for being here with us. And a reminder, sign up to WRAL.com for any news.